Hello, my name is Dr. Sharma, and I'd like to welcome you to our Express to Surgery for wisdom teeth. If you have wisdom teeth and you're between the ages of 14 and 26, we developed this program to hopefully minimize the amount of time you have to be in our office and decrease the amount of time you have to miss from work before you can schedule your surgery. My goal today is to kind of review with you why wisdom teeth become issues between the ages of 14 and 26. Talk to you about why you have them, talk to you about what your options are as far as they're concerned, and talk to you about the benefits or the alternatives you may have to treatment. If when we're done with this consultation, you feel like you want to move forward, well then we'll ask you to come in for a quick 5-minute x-ray. With that x-ray, then we can set up a teleconference to where we can sit down at your convenience and review your specific situation. Once we've had a chance to do that, you'll know exactly what your needs are. And then you can decide whether you need to move forward with surgery or whether you can delay or wait a little bit. So with that, let's get started. Wisdom teeth are nothing more than a third set of molars. What are molars? Molars are these big chewing teeth here on the back. First molars typically come in when you're 6 years old. Second molars typically come in when you're 12 years old. And these red dotted molars, though, those are your wisdom teeth. They typically come in around, well, your age of wisdom. Many times that's somewhere between the age of 17 and 20 years of age. Those wisdom teeth, as they develop, are the last teeth to come in. The issue that we have with wisdom teeth is that our jaw slopes up as we go further back. That's how we are able to have everything fit in our mouth. But the bad news is that these wisdom teeth don't have enough space to fit. If we've had orthodontics, where the orthodontist has lined everything up, then the problem we face is that there may not be enough room for these very last teeth, and they'll start to pinch or grow onto the back of these other teeth. This can become an issue because as those teeth try to come in, we don't want them damaging those teeth in front, and we don't want them to get stuck or cause an issue with a cyst or an infection to develop. For us, the other issue I have is making wisdom teeth go away before they start to develop completely is much better for a patient. One, because there's much smaller teeth that have to be removed. They haven't had a chance to fully develop, so their roots haven't fully formed like the roots of these other teeth. And the biggest reason why, too, is that there's a nerve located in your lower jaw. This nerve supplies the feeling to your bottom lip. And these wisdom teeth, if those roots haven't developed, haven't had a chance to connect or wrap around where that nerve is. So in many situations, if we wait too long, the problem we run into is that these wisdom teeth, the ones again with the red dots, then will develop further and they'll grow into the backs of those other teeth more, causing more damage to those second molars. But then those roots develop and they develop across where that nerve is that we've indicated right here. And then when we get asked to make them go away, there's a much greater chance that it could affect the feeling in your bottom lip and could result in you having numbness that could be permanent. Now, fortunately for us, before the age of 26, the risk of that is very small. And we can do things like get CT scans taken that allow us to actually evaluate where that tooth is, specifically in relationship to that nerve. We can look at your face in 3 dimensions, and by doing so, then quickly identify where that nerve is in relationship to where those teeth are, so we can minimize any risk to you. So for me, the goal with removing your wisdom teeth is purely to do it at the right time. And when that time is typically when those teeth are still developing. And that most frequently is going to be between the ages of 14 and 26. So once we get your x-ray, we'll know exactly where your wisdom teeth are. We can talk specifically where the lower ones are and where the upper ones are, and what the indications for them both to be removed are. After we remove your wisdom teeth, then we can allow those areas to heal. In general, that amount of time typically is going to take between 7 and 10 days. And if we can plan this out, then we can make it much less of an inconvenience for you. So my goal here is hopefully I've shared with you why we have wisdom teeth and where they're located and why they become a problem. If you'd like to move forward with your next step, then please let's schedule that 5-minute x-ray so we can get your specific situation and review it in person. We'll do it over teleconference for your convenience, and then we can decide what we need to do with surgery. I hope you found this helpful. I thank you for taking the time to review this ahead of time. And most importantly, if you'll complete your paperwork, we can go ahead and start processing an insurance information for you too, so we can give you the best estimate about what coverages you can maximize and take advantage of. I hope you have a great day. Thank you very much for your time. If you have any other additional questions or would like to schedule a consultation in person to review your situation face-to-face, by all means, you have that option and we welcome it. So just let our office know and we'll be more than happy to take the time to do that. Have a great day.